So I would like to introduce our two speakers today. Our first one is Sid Misra, and he is the Senior Lead of the Digital Strategy and Development, and is focused on extending the Healthy Interactions mission of personal health engagement through digital support tools. And he is one of the brains behind HI's health applications, focusing on intuitiveness and the ability to connect patients to people and information that can help them gain control over their health conditions. And the second one is Julia Sock, and she is the U.S. Training Manager and ADA Program Coordinator, and she has nearly a decade of clinical experience in diabetes self-management education, working with patients of all ages with type 1, type 2, gestational, and monogenic diabetes. She has worked as a registered dietitian and certified diabetes educator within diversified academic and community settings in the Chicagoland area. And at Healthy Interactions, she currently serves as the ADA Education Recognition Program Coordinator, Continuing Education Program Director, and the U.S. Training Manager for the Diabetes Conversation Map Program. Essentially, they are both very, very well-versed on the topic today. So without further ado, I'd like to introduce Julia to start off our webinar.
Thank you so much, Radha. On behalf of Healthy Interactions, I would like to thank you all for taking the time to join us. We are so happy you are with us. We know how busy you are. For today's webinar, we will discuss the role of patient engagement in chronic disease management, explain what the digital engagement platform is, how it could be integrated into existing diabetes self-management education, and also talk about the resources that are available to you. But before we go into the content, we'd first like to get to know you a little better by launching a quick poll. We would like to know if you are currently providing support between your diabetes education sessions. And this could be in any form. It could be emails, phone calls, support groups. So if you could take a moment to enter in the number that corresponds with your answer, we'll just give that a minute to have you all respond, and we'll go over the results as a group. Okay, another couple minutes. Okay, so it looks like the majority of you are not providing support between sessions. 16% of you rarely, 26% of you often, and 11% always. So thank you everybody for taking the time to go over that. And we'll move on to the first part of our webinar. Before Sid discusses the digital engagement platform, I'd like to begin the webinar by discussing the role of patient engagement in chronic disease management, since this ties into why the digital engagement platform was developed in the first place. So most of you on this webinar are probably already familiar with Healthy Interactions because you've been formally trained on our programs in the past. For those of you who aren't familiar, Healthy Interactions has provided validated patient engagement programs that improve outcomes for people with chronic diseases for over a decade now. Unlike other programs that are out there, our curriculums are unique since they promote patient engagement. And we do this because we know that managing a chronic disease puts the person living with the disease at the center of their care. On the next slide, we'll briefly touch on the changing economics of chronic care, since this ties into the importance of engagement. And I'm sure many of you are already aware of this, but the economics of chronic care are definitely shifting. Patient engagement is a critical factor for both the current model and the future model, but it'll play an even larger role in reimbursement in the future as this shift continues. Currently, a fee-for-service model is widely being utilized, and this mainly reimburses for in-person care. And the reimbursement received from this is really independent of the outcome of this interaction. But the reimbursement in the future will be outcome-driven. So in other words, the reimbursement will be more pay-for-performance, which will be based on the positive clinical outcomes that do result from those interactions. The future model really needs to move away from medical-centered care to patient-centered care to drive those outcomes. And on the next slide, we'll discuss the difference between medical-centered care and patient-centered care. So what is the difference between the two? Medical-centered care is when the provider is telling the patient what they need to do. So this results in a patient that needs to adhere and comply with those recommendations and is totally dependent on the provider to determine their needs. There definitely are some situations in which medical-centered care is appropriate, such as for acute care. So using an example where a patient maybe has a bacterial infection, it requires the provider to diagnose it, prescribe antibiotics, and then specifically instruct the patient on what they need to do to clear up the infection. So if the patient does what they're instructed to do, the infection goes away and there's no more need for care. But on the other hand, patient-centered model is really more appropriate for chronic disease management, since the care must be ongoing. With a chronic disease, it will be ongoing and lifelong. So chronic disease management requires that the person living with the disease takes on this active role along with their healthcare team. So the patient will be autonomous and active in helping to determine their needs, and also active in the planning process of how to meet those needs with their providers. So this person will be empowered and engaged, and then this is what will lead to those more positive outcomes. The next slide is going to illustrate the impact of engagement on outcomes based on research that has been done. The research shows that engaged patients are more likely to perform self-care behaviors. They're more likely to utilize self-management services that are available to them. They also report higher medication adherence, which directly affects glycemic control, and for some also cardiac health and other medications that they're taking for other conditions. They're also more likely to initiate discussions of symptoms with their healthcare team, and they're involved with that shared decision making, as we just talked about on the previous slide. And most importantly, there's very high patient satisfaction scores and high quality of life scores for engaged patients that also leads to better functional status. So all around, everybody wins, but especially the patient. So on that note, I'd like to throw it over to Sid to take us through the digital engagement platform.
Thanks, Julia. So again, I would like to extend my thank you to everyone for taking the time to be here and to listen to us talk. As we get into the slides around digital engagement, really I want to take a moment, if we jump to the next slide, to kind of talk about where we are today. And so when I think about the Conversation Map program, and Julia threw up a slide earlier about how we're around the world, but even just within the US, we have over 1,400 health centers who've deployed the maps, 30,000 facilitators trained. There's different tools for engaging people, and obviously training as well. And we've seen a significant amount of success in the US and abroad. And all that to say that we've done a really good job, in large part to all the work that you guys on this call have done with your patients. And yet what we see is that those results are happening when patients come in 4 times, if we're lucky, I guess, for the different map sessions. They come in for one-on-ones and maybe appointments, but there's so much time otherwise that patients are trying to manage their journey with diabetes. So going to the next slide, what we saw was an opportunity in terms of how do we further engage patients. We can see that there is engagement happening when they come to these sessions. There's engagement around the content, the educational material, and the group itself. And what we'd love to do is be able to take that engagement further. So when we think about the challenges we're trying to solve, what we see is a successful program and our ability to extend upon it. And so when we think about digital, we think about how do we engage patients? How do we, knowing our demographic and knowing that there's so many options out there, how do we make sure that both patients and healthcare professionals, and that's HCPs, you'll see that throughout the deck, is healthcare professionals, how can we inform them around tools? How can we commonize a set of tools that can help them in the way they talk to patients? and help patients in terms of weeding through the amount of apps that are in the app stores. Older patients may be more hesitant to use the apps, and yet we have this incredible platform where patients are going to be together with an educator, so there's an opportunity to get them past an initial hurdle. There's data that suggests that the real issue around adoption of healthcare technologies is the adoption phase. Once they're in, and this is not just healthcare, but just general app usage, once an older demographic is in, they tend to engage, especially around social functionality and with other people. So what we'll show you is kind of the opportunities we have to take advantage of that, get them on board, get them adopted, and then get them to engage. In addition, we will present what we've done to help healthcare professionals see the other side, so how patients are doing when they're at home, and give them the tools that they, if they choose to engage with those patients when they're at home, and be able to offer additional support. The last point I'll touch on towards the end a little bit. We won't be covering it as much in this webinar, but one of the issues we see is the change in workflows, or the impact to workflows that technology can have, and there are some opportunities with Healthy Interactions based on our coverage of our conversation maps and our ability to bring that all into the digital space, to not have to really think about new technologies for every new condition that you're helping patients out with. So those are the challenges, and what I'd like to do over the next set of slides is really start to talk about how our digital engagement platform helps address some of those challenges. And we'll be doing it within the context, again, of that existing conversation map or Journey for Control program for those that are using it today. But it also fits with any kind of DSME program if you're not using the conversation maps today. But what you can see on this page, when we're talking about digital engagement platform, there's a couple of tiers to it. So what we really wanted to do is make it easy to adopt. Not everyone is ready from a health system perspective, from a healthcare professional perspective, to provide either coaching or support services, but they are interested and willing to provide tools and an extra set of tools to their patients. So we wanted to make it easy to at least get to that first step where there's an issue, from a MAP program, from a DSME program, from a session, there's something that you can give to patients to take home to continue to engage in their health management. And we'll talk through some of the functionality that's available to the patients today and what's going to come in the future. On top of that, though, we do want to have, for those that are able and have the capacity and capability to adopt sort of a management or coaching side and support side to what they're doing. We'll cover that a little bit today. Our focus is mostly going to be on the app, but there is the option to extend the program with what we call our professional series, which includes a population management portal. But the key really is how do we get the patients to engage first. So as we jump into the next slide, I've been kind of hinting at it, and I keep alluding to the existing conversation map program, existing DSME program, and what we wanted to do was not create just some add-on additional extra tool or app. Again, there's so many apps out there, but we wanted to create a system that kind of works, a workflow that makes it easy for health educators, makes it easy for patients to understand how to use and how to kind of onboard and get going with technology. So when we think about our digital engagement platform, it's not just the app, it's not just a population management portal, but it's really an integrated experience that starts before sessions even happen. So it starts with training, it starts with materials that are available to healthcare professionals, to health educators, so that they are better informed about how they can both recommend the tools and inform about the value of the tools, and get people started with using technology. The second step is then going into the session itself. When you think about that first MAP session, you think about some of the outcomes of that MAP session. We have patients who are starting to engage. They're getting activated around technology, around self-management. There's an increase in their confidence and an increase in their motivation, and it would be great to start to take advantage of that increase in confidence and motivation and give them something at that moment that helps them take that away from the session and continue at home. And that's what we're looking for with our patient app, especially, is this is a great opportunity to instruct them about how digital can be impactful in their self-care journey, and that we can take a bit of time in a session to instruct them on how to onboard or provide them materials that we prepared and can share with you to give to them so they can do it at home. In between map sessions, they continue to engage. We'll talk about some functionality around that. And then as you think about as they come back to map sessions, there's already a discussion happening about how did it go between the last map session and today. That discussion can be enhanced if people have been more engaged in their tracking, just not only their health goals, but also their weight, their blood glucose, blood pressure for those that are tracking, any meals. So we can have an enhanced conversation, a conversation that's already happening in those sessions, but hopefully with more informed and engaged patients because they've been doing things along the way. And then finally, what I call graduation or post-session. Patients go to the sessions, they go home, and they're on their own. But I don't think any of us feel that comfortable with just putting them on their own. And again, this is where technology can help. They don't need to be on their own. And even from a engagement perspective with their health goals and tracking and education that can be provided through the app, that's one step of making sure they're not alone. But we can layer on additional support through group interactions and also through coaching services or population management services, which we'll talk about. So that's the overview. And I guess I want to spend some time on this slide, mostly to say that what we're not trying to do is just give you and talk about an app. What we're trying to do is find a solution that fits into the realities of what's happening today. So with that as the kind of backbone, let's now talk about some of the functionality of the app. And we'll do it within the context of that flow that we just talked about. So on the next slide, we mentioned onboarding. So that first map session as an opportunity for onboarding. And we talked a little bit about this already. So being able to overcome some of the common barriers to app usage, which is really just what apps to use. Why is it important that I use an app, or why is it maybe not important, but even valuable that I use an app? What are some of the things that I will get out of this particular app? I can imagine, and we've heard from healthcare professionals, we've heard from patients that they are talking about technology. It's increasing in its common and how common it is to be talking about technology. But there's so many out there that how can patients have a real conversation around it? How can health educators have a real conversation around it without trying to know everything, which is obviously an impossibility with just the sheer numbers. So to try to bring everyone back to something that can do some of the jobs of what those are, but based on the MAP program, so it's kind of very focused, is something that we think we can provide a lot of value. And then, from a functionality perspective, we make it super simple for people to get onboarded within the MAP session to connect with an educator if they choose to do so. And then, in order to be able to actually do tracking, again, we are very focused on who the actual patient is, their age, their familiarity with technology. We want to make it really easy for them to set up a goal that either we've set up, we've got some preset goals. There's soon going to be the ability to create their own custom goal in a week or two. Really make it simple for them to just set it up and then get tracking. And you can almost imagine this happening at a session when they're already trying to set a goal and take it home. This is now kind of replacing that paper base and moving it into technology, so they just have it with them and they have the reminders that kind of go with them. Again, keeping it really simple for them, understanding that they're not going to be instantly comfortable with technology, even with the onboarding. So I'll move into the next slide. So this is kind of going again in between the sessions. So we've had that first session, they've been onboarded. This is starting to talk a little bit and crossing the lines between what a patient can do and how educators can support. Again, we have this kind of tiered system. So if you think about just the patients to start with, what can they do today? They can set and track their health goals. They can track weight, blood pressure, blood glucose. They can create a photo meal log. So we do think it's important that patients are paying attention. People with type 2 diabetes are paying attention to what they're eating. we know that there's calorie counting tools out there, but we also know, and we've seen from not just our own experience, but from the experience of patients, that they have, it's challenging. It's not easy to use to be able to track all your meals, especially when you start making stuff at home and adding all the different ingredients, and it can become very cumbersome. Whereas everyone pretty much, once you get familiar with a smartphone or start to use a smartphone, like one of the main aspects of the phone that you start using is the camera. So being able to just take a picture of a meal and create that accountability from just a picture to remind yourself that okay, if I take this picture, I'm going to see it again, so I want to maybe pay more attention to what I'm eating. But beyond that, when you think about being able to have that connectivity to an educator or a care coordinator outside of those sessions, and to be able to get some feedback, so when you think about what educators can support, it's what all the patients can do. It's supporting their goals, how they can achieve goals, strategies for success, strategies for managing their blood glucose, nutrition counseling when you think about the meal photos, and then even just reaching out to them. So when being able to see through a dashboard what patients haven't been checking in a while, and just sending a quick note, either personalized or automated, to say, hey, we've noticed you haven't been checking in. Anything we can do to help? So try to engage the patient. This is all we're talking about, is like different levels of engagement. Tier 1 is what the patient can do on their own. Tier 2 is how educators or care coordinators or anyone within the health system can jump in and also participate. On the next slide, we break down the patients a little bit more. Again, what I wanted to focus on is just kind of how clear and simple, like large fonts. We're not trying to make something that is incredibly challenging and over-functional. We want things to be very simple. So there's a dashboard that has a list of their goals and the things that they can track. Every day you can kind of go in and see how you're doing. It's very easy to update with just this quick swipe. The buttons are large so that there's no issues with hitting it. Again, we've been testing. We've been asking people to provide their feedback, and we've been adapting given our target demographic. The goals extend into the tracking, so the clinical tracking around blood glucose and weight and blood pressure. We talked about the meal log. You can see for your day the different types of meals you've had. It's easy to go back in time and see meals you've had on previous days. And again, if this is all shared with the health educator or with the care coordinator, they can see it as well, and they can respond to ones, especially if we start to line them up with where there might be elements of high or low blood glucose. If you can put it beside a meal, you can start to create real insights, and that's kind of where we're moving as a bit of a teaser, I suppose. Finally, there's education. So those of you that use the conversation maps, the format, it might look a little bit familiar in terms of those cards that you hand out in sessions for people to participate. We try to bring that element back into the app, but now we can, because it's an app, make it a bit more interactive as well. Rather than just sit there and read, we can sit there and show. Eventually, we're working on functionality that'll let them interact through quizzes and polls and be able to be more participatory in that education beyond just text, images, and video. Going to the next slide. So as much as this is focused on the app, I do want to bring up some of the work that we're doing on the portal side for those that are interested in kind of population management functionality. This is just a high level, and I'm happy to go in on a kind of more one-to-one level with people who are interested. But what we're building is a portal that will provide both population management, so being able to look at a list of patients, being able to have really simple call-outs to where some of the trouble spots are, or where some of the success spots are too. I don't think we need to focus on just what isn't working. We can also focus and celebrate the things that are working for people. So the image on the left is kind of that population view where you have large buttons that say, who's new, who's been lapsing, who's had goal success, who's had goal challenges, who's got high or low blood glucose readings. Eventually, we'll talk about weight trends, and we're continuing to populate and making it really easy for anyone to just jump in and say, okay, if I have a couple of minutes, here are the 4 or 5 things that I could probably try to do at once. And then for those that want to, they can also dig in further. And we talked about some of the abilities for nutrition counseling. The image on the right is one example of kind of going more personal. looking at someone's actual meals and be able to talk about, what are they doing right, or what could they be improving on for a certain type of meal, like breakfast, a lunch, or supper, whatever, snacks. We can start to have a discussion and a conversation around how people are eating, how people are snacking. Carrying forward, bringing it back to the map session, you can start to see, hopefully you'll start to see as I talk through this, how this all kind of fits back in. Again, whether it's just the patient app where people are going home and tracking, something that we're already asking them to do, we're just giving them a tool, we're providing additional education, we're making it more interactive for them to do so, and they're be able to bring that back to the conversation, have more enriching conversation in those follow-up sessions, and that's just if they have the patient tool. For on the educator side, if you had access to some of that information, you could bring some of that up into the session itself. You could imagine being able to see different challenges people are having around it, and being able to, without having to name who's having the challenge, just be like, hey, as a group, I've seen that some people have had success with their activity goal. Some people have some challenge with activity goal. Why don't we have a conversation about what's going on, and so we can understand what's working for some people, what's not working, and come up with some common strategies so the whole group can be successful. Going to the next slide. So all the functionality we talked about is, it's stuff that they take with them as they go, and it's stuff that for people who want us to engage in kind of the population management side, they can continue to do it after the sessions. It can be as long as they want in terms of how long they want to engage with patients post sessions. So everything I mentioned stands true in terms of what they did, what happens as they graduate. But what I also wanted to show is kind of where we're going beyond where we are today. So we really believe that the strength, and I think many of you would agree that one of the biggest strengths of our Conversation Map program is that group interaction, that relationships are being formed in those sessions. People are sharing strategies. People are, creating friendships and also just creating partnerships where they're able to share some of their own stories in a way that's comfortable, because these are peers, these are people who understand what they're going through. So what we want to do is, again, be able to extend that outside of the MAP session. So as they graduate, continue those conversations, possibly with their group, but also with the broader diabetes community that can engage, not just in terms of conversation, but with shared content that we can provide through an activity feed interface. You can imagine us posting new tips or new information and let people talk about it. We can ask questions, we can engage people with quizzes and polls, and again, create the conversation outside of a MAP session and continue that conversation outside of a MAP session. There will be functionality for health systems and educators to also provide content and engage patients in this way as well. So that's kind of looking forward to where we want to go. So back to that list of the challenges we are trying to solve, what we're really looking for is how do we bring people together and keep them engaged outside of these sessions that have had such a great success in starting that engagement, but we want to maintain that as much as possible, because as Julia has mentioned, engaged patients leads to significant benefits. We want to reduce the confusion in terms of the number of apps and try to get people, be able to talk a common language from session to session, be able to have an easy way and kind of a more focused way that people can communicate around health technology, have that be part of the training, have that be part of the initial MAP sessions themselves, and how it's going to brought back into the sessions, and overcome some of the barriers of app usage that we see today. A large part of this, people, just they're hesitant to get engaged with apps. So how can we break those barriers? One of it is to try to bring, taking advantage of that activation, that motivation, that confidence that they feel after that first MAP session. As I mentioned on the last point, we didn't really spend time talking about it today. Again, just to kind of cover that Healthy Interactions has a large suite of conversation map programs for diabetes prevention, obesity, COPD, CHF, you name it. We probably have a map for it. As we think about how we move forward, again, without having to have a separate technology or a way to engage patients for each one of these, how do we bring it into a singular workflow that makes it really easy for everyone from a patient's perspective who, the data suggests or shows that patients with type 2 diabetes usually have at least one other chronic condition as well. So how can we support multiple chronic conditions with just a single tool as opposed to having to offer and learn multiple tools? The next slide is kind of on that point about what Julia brought up earlier, just a reminder, I guess, on where engaged patients can lead us. So if we can engage them beyond the sessions where we're already seeing a level of engagement, all of these things just continue to grow and blossom. So that is our focus as a company, that is our focus in terms of our digital engagement platform, is how do we continue to engage patients so that all of these things that can continue to grow and continue to evolve in our patients. I'll end my talk, and I hope it's been informative. I hope some of you are more aware and have more information now in terms of where we are today and where we're going. So what I'll do is I'll end my talk in the next couple of slides, just talking about kind of what's available today and what kind of where to go get it. So in terms of the conversation map, it's already available for those that haven't seen it on iOS and Android. You can go into the app stores and you can download it and check it out yourselves. Goal tracking, biometric tracking, education, all of that's there. Meal tracking is available on iOS. It will soon come to Android. And for both Android and iOS, we'll soon be bringing in activity feed functionality with all the functionality I've mentioned around being able to interact with peers and interact around content, so it's more dynamic. And on my last slide, in terms of the population management portal, we have a portal ready. We can show and demonstrate functionality. There's the ability to engage patients through video or text. It's secure. We're HIPAA compliant. We're going through our high trust certification right now. And soon we'll be adding functionality to integrate directly into EHRs, having even more. We see some of those kind of flagged buttons that help identify areas that you can look at. We get adding some more that provide a lot more information to once you log in, as well as analytics across the group to show how trends over time are changing. And then for those that are trying to qualify for CCM reimbursement, we're adding time tracking, so the amount of time you're spending with each patient will be logged, so you can use that as you reimburse for CCM. For all of that, like I said, the app itself you can go and download today from the store. You can create your accounts. You can try it out. We'd love to hear your feedback and any suggestions. At the end, there'll be an email address. You can send all of that through there. On the population management side, we'd be happy to show you what it looks like today and talk about where it's going and see how it might fit for your workflows or for your organizations. So with that, I'm going to hand it over back to Julia.
Great, thanks, Ed. So for the next part of the webinar, we'll take a little bit of time to discuss how the digital engagement platform can be integrated into existing diabetes self-management education programs. So the next slide, we'll first discuss why to recommend it as a part of your program. And I think Sid hit on a lot of these points, but the purpose of diabetes self-management education and support is to prevent or delay complications of diabetes by providing a person with the tools necessary to understand and manage their disease. So in essence, this diabetes self-management education is the activation of potential behavior change. But how do we as educators continue that engagement once the education is completed? The platform that Sid just took us through is another tool that's going to help provide that support between sessions and post-program to help keep that engagement going. Many of us as providers are already recommending one or more digital tools for this exact reason. But this particular platform, being an extension of the Conversation Map program, you could be assured that your patients are using an app that has reliable information and is easy for them to use. On the next slide, we'll discuss how the engagement platform fits into the national standards for diabetes self-management education. What you see before you are the 10 standards that a recognized program must meet and uphold to maintain their program recognition status. So recognition status is required for programs who want to seek reimbursement, but it's appropriate even for programs who aren't interested in recognition or reimbursement, since the national standards really are a recommended framework to provide a high-quality diabetes education program. As many of you already know, the in-person Conversation Map program meets the requirements for Standard 6, since it is a complete curriculum and covers all of the 9 necessary content areas. But the engagement platform tool fits into these standards as well. So specifically in standard 7, 8, and 9, which are bolded there for you. The platform allows for continued individualization, as we know that the needs of our patients change over time. And it also provides ongoing support after the patient completes the in-person education program. And in addition, you could evaluate the patient's progress through the platform to see how they're doing with their behavioral goals and provide any guidance when needed. And this is also helpful for reporting for those of you that are familiar with annual status reports for ADA and AADE. A lot of this information captured in the platform will aid with that. While Standard 10 quality improvement isn't bolded, the platform could also help to evaluate the effectiveness of the education provided to help you make any changes to your program if needed. So on the next slide, we'll discuss when you can introduce the app to your patients. Depending on what works best for your program, there really isn't a single best way to introduce the app, but I'd like to provide you a few examples just to get you started. So the first option would be to introduce the app to a patient before a Conversation Map session. Unfortunately, due to limited hours in diabetes programs, sometimes there might be a little bit of a wait time for a patient to actually get in and see an educator. So certainly the app could be introduced at that time to help the patient to begin that engagement process and also provide them a great tool that keeps them interested, so they're more likely to follow through and actually come to class on that first day. You can also introduce the app during the goal setting portion of a Conversation Map session. I'll circle back to this in just a minute or two when we talk about resources, but Healthy Interactions has developed a quick patient handout about the app. So during this time at a Conversation Map session, you could certainly hand out that PDF to your patients, and you could explain that the app is a really fun way to keep track of their goals, and also in a very interactive way. You could also introduce the app at the point in the program where you're talking about how the patient is going to gain support post-program. So for those of you on this webinar that are part of recognized or accredited programs, you know that your patients need to choose something for support in accordance with Standard 9 after they complete the program. But even for those of you that aren't part of a recognized program, again, I think we're all looking for ways to help support our patients. And for many of us, we provide a typed list of options. And a really easy thing that you could do is add in the app to your current list. And if your patient selects that, you could go ahead and provide them more information if that's appropriate. So for the next part of the webinar, let's go through some of the resources that are available to you. And the next slide gives a quick rundown of how to download the app. So Sid had mentioned that it's already available in the Apple App Store and the Google Play Store. I'm sure I'm not alone here and being a diabetes educator and liking to check out any tool first before I recommend it to my patients. So we certainly encourage all of you to do just that. Download it, create an account, play with it, and if you like it, go ahead and recommend it to your patients. And certainly, please, as Sid mentioned, be in touch with us. If you have any questions, even about the downloading process, we're here to help you through that. On the next slide, we have here the name of our LinkedIn group. It's called Diabetes Educators Using Conversation Maps and Digital Engagement Platform. So we created this group on LinkedIn because we wanted to make sure that we had a platform for conversation map users, as well as those that are recommending the app to their patients and those who are interested in the engagement platform. We want to make sure that you connect with other healthcare providers, as well as the Healthy Interaction team at any time. If you have any questions or need advice or need support, we're always here to assist you in any way we can. So please consider joining us on that group. We'd love to see you there. I mentioned a few minutes ago that we also have a patient handout that you could provide your patients. So the next slide shows you a screenshot of the facilitator portal. So for those of you who have been trained formally on our conversation map tools, you already have an account on our website. So if you log into that account, you'll see under resources, there is an area that says Digital Engagement Platform. It has in red new next to it. The handout that says Conversation Map Sheet for Patients, that's what you could download if you'd like to start recommending this to your patients. But please note that we also have an FAQ on there if that's helpful, and also a sheet specific to educators. So now that we've learned more about the platform as a group on today's webinar, we'd like to take a minute to do another quick poll, this time asking how likely you are to recommend the conversation map to your patients. So if you could take a moment and input your answer, we'll go ahead and review those results once everyone's finished. Okay. Okay, great. That's everyone. Thank you. It shows here 84% are very likely to recommend it to your patients, and we're certainly thrilled to hear that. And for those of you that's somewhat likely or neutral, we'd love to hear your feedback. And on the next slide, we actually have the contact information that Sid was referring to. If we can get that shown for you. But if you have any hesitations or anything that you have questions about, we'd certainly like to be able to keep the lines of communication open. I think our screen might be a little bit frozen here, but we would like to take a couple minutes to review any questions that you all may have typed in during the course of this webinar. So Radha, do you mind sharing if there were any questions from the group?
We do. So once again, anyone who wants to answer questions, there is a chat box that's in the GoToWebinar portal. Just feel free to type in your question, hit send, and we'll be able to share it with the group. One question is, who should I contact if I want to start coaching some of my patients?
So Sid, do you want to jump in and take that?
Yep, sorry, I was on mute. So there is a link, so you can contact. The email address is hiapp@healthyinteractions.com. Just send us an email, letting us know that you're interested, and what we will do is we'll have either myself or someone else will reach out to you to just get a bit more information. We can set you up with an account that you can try out, and we can also provide more information about potential costs and see how it could fit within your organization. So the email again, hiapp@healthyinteractions.com.
Perfect. I have a question here about integration. With the onboarding of different apps such as MyFitnessPal and the new Apple Watch, is there any plans in the future for any type of cross-integration with any other support softwares?
That's that's a good question, and I apologize for not having mentioned that earlier. So what we do currently on iOS is we integrate with HealthKit or the Health app. So any apps or devices that are sharing information already with the Health app, it'll be pulled into the conversation map. It'll be shared for those that are using the population management portal. It'll be shared directly to there. We are extending that integration in the very near future. We're looking at some partnerships where we can integrate many more both Bluetooth apps, and also since we know that there's not too many. While the trend is going towards more digital glucometers and Bluetooth-enabled glucometers, we know a lot of people don't have those yet. So adding functionality that lets you even just take a picture of your reading on a normal glucometer and have that digitized into the app itself. So there's already some support through HealthKit or the Health app for those apps and devices that integrate. On Android, we do it through Samsung S Health, and there's kind of easy step-by-step instructions on installing once you download Android for those that are not using Samsung devices. So we do support. We have some level of support, and we're increasing that level of support going forward.
That sounds very exciting. That's fantastic. And another question here is, will you be having more educational webinars about the digital platform in the future?
Yes, actually, thank you for that question, and that was something we were going to mention in closing, but we will be offering future webinars as functionality increases, and we do hope that you all will join us for those future programs.
And just to add to that, what we'll try to do, it won't be all the same content. As you can see, we are being ambitious in terms of what we're trying to achieve, and what we can share definitely in each webinar is new information on where we are, some of the functionality, what we're learning as we go through that process, and we can start to focus on specific sets of functionality as well to get more detailed. And anything that email us, let us know kind of your thoughts on this webinar. Are there certain topics you wish that we did cover in more detail? And we're happy to continue to do that in upcoming webinars as well.
Wonderful. Okay, I think that is all of our questions. I have one that I want to finish off with the two of you. Julie, let's go first because you were first to speak on the webinar. Just give me, what is your favorite part about the conversation map?
Right, so I think for me as an educator, what I love about it is that this is an app that could be as simple as it needs to be for patients who maybe aren't as comfortable with technology, and it could be as advanced as needed for our other patients that really do want some more meat to it. So it's something that can be used really for any class, depending on that level of comfort. And I know in the past, in practicing, it's difficult to find a tool that works for everybody. So what you find is that you're recommending one thing to one person to another. So I love that this functionality really appeals to different levels of technical ability. And I also love that it ties in with the conversation maps that I love so much, and I'm sure other educators on the webinar right now really love. So it's that trust there that the visuals and the information is presented in a very consistent way.
Wonderful. And Sid, how about you? What's your favorite part?
Yeah, I'll just,
about the conversation map.
it was going to be kind of the second part. For some of you that you may have seen previous webinars or seen newsletters, you know, we didn't have as strong an integration with the conversation map program, and we realized, you know, pretty quickly that that was a mistake. I mean, there's a lot of love for the in-person tools. I think for us, it's really this how we bring conversation maps to life in digital, how we create additional conversation and ongoing education. I'm excited for, you know, where we are today, but I'm probably even more excited for where it's going. Right now, the conversation is kind of between the educator and the patient, whereas you know, in the future, when you think about being able to continue conversations from a session digitally, you know, for us, the realization of this is not kind of everyone sitting in front of their computer at the same time on a kind of a web-based webinar-ish conversation map. I think we've seen challenges in that. I think the idea of it being more asynchronous, you know, people interact when they are ready to interact and when they can interact, whether that's, you know, on the bus, whether that's in the evenings, whether that's the first thing in the morning, whenever. We want to make it relatable for when they're ready to use it and when they want to use it. So for me, that's what I get excited about in terms of where this is going, and I think there's lots of tools there already, and for how they can engage today.
Fantastic. Thank you guys so much. Thank you for joining us on the webinar, and thank you to everyone listening in and tuning in for this webinar. Once again, if you have any questions, contact us at hiapp@healthyinteractions.com, and you can also check out the Healthy Interactions website for all of our upcoming webinars as well. This webinar is recorded, so please stay tuned, and we will see you soon. Take care. Have a great day.